how do we utilize AI that actually gives somebody a health plan for life? So I could see that almost fitting into aesthetics to say that prejuvenation is, hey, this is what your plan should be, so you don't get wrinkles at the end. You could take it a step and say, from an oncology perspective, can AI help drive somebody and say, these are the steps that you need to take to prevent these types of cancers over time?
Hello and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And today is no exception. Today we have Bill Carpou here in the studio. He's come up from Orange County, and we're going to hear all about what he's doing in the beauty business and other areas also. Bill, thank you very much for joining us today.
Grant, thanks for having me. What a pleasure.
Yeah, it's so great to have you. You work so closely with Allergan and the other aesthetics people and so forth. But before we get into Octane and all that, first of all, where are you from, Bill?
New York originally, so just outside of the city in Long Island.
And when did you leave?
Well, see, now I'm going to date myself.
That's all right. You don't have to tell me that. Okay, where'd you go to college?
I went to college at Villanova, down in Philadelphia. So kind of went from New York, spent some time in the Philadelphia area, and then moved out here to the West Coast in 1998. So an East Coast transplant, and came out here for 2 years to run a turnaround, and here I am 22 years later. So okay, what kind of turnaround was it? What kind of industry were you in initially before Octane? Yeah, so I mean, immediately before I was an operating partner at Blackstone.
Okay.
But what brought me out here was I was an executive at a company called Icon Office Solutions, and office equipment, copiers, printers. I mean, completely unrelated to this, and to anything in the medical business. And so it was, it was basically the end result of a lot of different acquisitions here in the Southern California area. And ultimately, that organization has gotten sold to Ricoh, and myself, as well as all the senior executives, kind of disembarked at that time. And then I got into private equity.
Okay. Down in Orange County, right?
Yes, but a lot of travel. And I actually, so a lot of travel back to New York, a lot of travel throughout the country. And then I ended up running a portfolio company for Blackstone in Detroit. So kept the residence in Orange County, but was really living out of the Detroit area, which was interesting in a very positive way.
Well, that's good. And when did you form Octane?
Well, Octane was actually formed before I got there. So I've been the CEO for 6 years now, since 2015. But the organization was formed in 2002. And so last night we had our High Tech Awards, and we announced that we're going to celebrate our 20-year anniversary next year in 2022.
And I didn't realize that.
Yeah.
So then you took over, and you're the CEO.
Correct.
And tell us a little bit about Octane. Many of our many of our viewers don't know anything about Octane. So take me through what Octane is and what their core philosophy is and so forth.
Yeah, so Octane's an interesting organization, and it's somewhat complicated in terms of the structure and what we do. And we position ourselves as having 4 core cornerstones from that standpoint. So the first is really the legacy. It's what was formed in 2002, and we refer to it as Octane Connect, and it's really all about content and thought leadership in the technology and medical technology industries. So aesthetics certainly happens to be one of them. Big footprint in ophthalmology. And generally, we have distributed that content through in-person events.
Okay.
And obviously, 2020 changed all that, and we moved to virtual platforms. And here we are now saying it's hybrid. I mean, what we really found was we went from this moment of saying, oh my God, we're not going to do a live event in 2020, to finding we're getting 3.5 to 4 times the audience on virtual. And so now we really view ourselves as more of a content provider with the ability to stream to a much larger audience, and then have that content be available on demand.
So when you say content, are you talking B2B type content, or is it you to physicians, or who's your target audience? What's the content?
So it's It's not an easy question because we have a very wide and diverse range of interested parties. So it's certainly B2B, but then the physicians on the medical side become very, very key, since they're the ones that are distributing the product and all that. So, using Allergan as an example, Allergan is certainly an interested partner and a strong partner of ours, but then so is the whole physician network. So what we found in ophthalmology and now aesthetics is getting the physicians there and exposing them to innovation, because that's really what we're all about, versus just a normal clinical type of event. So our content is more innovation driven.
Okay.
So,
and you have a mixed audience actually then.
Yeah, the common aspect, and you might ask me if you come to an event one day, you'd say, well, who's your audience? And they're used to saying, well, there's all clinicians out there, or there's all physicians, or there's all investors, and we're like, yes. It's all of those. So it's a mix, and it's very diverse, and so we kind of frame our content to be able to satisfy that very diverse nature of individuals that attend our events and consume our content.
Well, Bill, first of all, I've been to the events and I love them. And secondly, you've just described my audience. Technology of Beauty, same thing. It's the same audience. Yeah, and it's cutting edge technology, and the content is geared not just physicians, in fact, to business, to industry, to finance. And so it looks like a very similar audience. So your first pillar of 4 is content driven.
Yeah, content driven. Emphasis on innovation. Okay. And so, a lot of the smaller companies that are creating that innovation, bigger companies that are consuming it, and how you basically bring that to market. Whether it's on the technology side, a cyber company, or how you get it in the hands of a doctor to a patient, on the aesthetics or ophthalmology or, clinical side.
Okay. What's the second one?
So the second one is our foundation, and there's 2 components to it. One is about community, and the other is about our accelerator. And so one focuses on community impact for Southern California. So there's a focus on women leaders. There's a focus on STEAM, which adds the A in STEM or arts. And if I just went back to the women leaders, kind of an interesting fact is that women comprise 52% of all startups, yet they only receive a slightly over 3% of the venture funding. So we looked at that and said, there's such a mismatch there. How do we help women entrepreneurs grow their companies and get access to funding? So that was the genesis of that particular initiative. And it's taken off, and it's really helped in terms of mentoring. It's helped women be placed on boards, either public or private. And then we've got the STEAM initiative. And then we've got another one that's really interesting, and it's supported by the Edwards Life Science Foundation, and it's using our accelerator, which I'll comment on in a moment, to really help other nonprofits that are rooted deep into underserved communities across Southern California. And then the fourth is identifying next generation leaders of the community. So taking really industry leaders that are known globally or certainly domestically, and saying, how do we help those people transition, and how do they become the successors of individuals that have been community leaders over time? Mm-hmm. And so that's really community impact. The jewel of this, though, has been our launchpad accelerator. And what we do is we deal with between 55 and 60 companies a year use our accelerator. And our accelerator is offered to entrepreneurs pro bono. So we don't take an equity stake. We don't charge a fee. It's supported by a grant from the SBDC, Small Business Development Center, which is a subset of the SBA. And the companies coming through are generally, if you look at it from an investment perspective, in that very late seed Series A range. So we're not the right place for someone if they say, could you help me write a business plan? Could you help me see if this is even a proof of concept? All those things need to be formed before a company comes to us. But we'll see 500 companies a year and then end up working with somewhere between 50 and 60. So we do a really good job of diligence. And those companies go through a 16-week program, very heavily mentor-driven. And statistically, 86% of them have raised capital within 12 months after going through the program. So in aggregate, we've helped companies raise a little bit over $3.3 billion since 2011.
Explain to the audience what an accelerator is.
So you've got incubation, early stage. So I've got an idea. Can you help me craft it? Could you help me write a business plan? An accelerator now is going to take that business plan, take that idea, and basically do exactly what it says, is accelerate it and move it forward more rapidly. And really what we're doing is we're preparing that entrepreneur for their first round of institutional funding. So how they're going to present themselves, how they're going to prepare, how they're going to present the opportunity in front of really sophisticated investors, much different than your friends and family round.
Mm-hmm. And you help with the raise?
We help with the raise too. So historically, and that's going to kind of get me into the third.
Sorry.
No. That's fine. So, traditionally, we basically were working and saying, okay, let us make introductions. So now we've added this third pillar of Octane, which is Octane Capital. And so that's where our relationships with strategic venture, so it could be a Medtronic, it could be an Allergan, it could be a J&J, or institutional venture, any of the big firms, Sequoia, NEA, Kleiner, are all, all of them we have really good relationships with. A private investor network, and it's where we actually have 2, soon to be 3 funds of our own. So once the company comes through the accelerator, we will make introductions and help represent that company to those investors for that raise. And that becomes more of a consulting and a platform that there are fees involved in that. So everything up to that point has been pro bono.
Mm-hmm. Okay, so that's the third tier.
That's the third tier.
The capital.
Yeah, and the fourth, the fourth is really, okay, now that you raise capital, how do you grow the company? So the fourth is actually a pure consulting platform that helps companies with operational and functional expertise. So when these companies are still relatively young, I mean, the companies coming through our accelerator don't have any EBITDA, and coming out of private equity, that was kind of a real game changer for me in terms of perspective. Many of them, most of them, don't have revenue yet. And if they're on the health side, they're well into FDA approval, but they're not final yet. So we really need to create a map for these companies to grow revenue and grow it rapidly. So the basis of the consulting or growth platform is, how do we get that company, once the funds have been raised, to commercialization and revenue that much faster? And so we could insert people that could help them from a financial perspective, from a sales and marketing perspective, from an actual going out and finding customers. And that's generally done by external advisors that are part of the Octane network. And what's kind of interesting, Grant, is we've followed a mantra to say that the general entrepreneur left on their own raises capital, and then as soon as they finish, they say, I got to raise more capital. And what we're trying to do is change that narrative and say, build your business. Your least expensive form of capital will be revenue. You'll dilute your existing investors less. You'll keep more equity for yourself, and you'll build more value for the company on a subsequent exit.
So you coach these entrepreneurs?
Yeah, we do. So we provide some direct coaching, but then there's a lot of individuals that are part. We've got about 250 advisors that are a part of the Octane network. Some are entrepreneurs that are between deals. They've sold their company. They're thinking of another idea, and they want to give back to the entrepreneurial community. Some are executives at larger firms and just want to spend some time with entrepreneurs. Some are semi-retired. Some are retired. Mm-hmm. So all of them, basically, we kind of marry them based on their specific talent with a company, and then the company takes it from there as to what that relationship will form. Is it going to be pro bono a couple of times? Are they going to pay fees? Are they going to give up some equity to that advisor? But we're providing that entrepreneur with really diligently vetted advisors that we know are going to be able to provide great results at the end.
Okay. And your basis, going back before you got involved, back 20 years ago, if you will, wasn't it founded along the ophthalmology line? I mean, I know it's technology. Was the medical part ophthalmology?
Ophthalmology is probably what we're best known for. So that did evolve a little bit. It was formulated, pure device, across cardio, neuro, ophthalmology, and then quickly ophthalmology elevated itself and broke out from everything else.
So not pharma, not topicals. It was device.
Historically. Yes, historically it was device. Historically it was device only, and what we found was there was an epicenter of innovation occurring here, and so while we think we had something to do with it over the years, Orange County and Southern California, and specifically Orange County, is the epicenter of global innovation for eye care, and in many respects, it is for aesthetics also. Mm-hmm. And a lot of that has to do with with companies such as Allergan, where they as a company certainly provided support, but you find so many individuals ended up leaving the company and becoming entrepreneurs, and so that was almost something that was encouraged and built a lot of the entrepreneurial spirit around eye care.
And how did it morph into or include aesthetics, and when?
So there was such great success with ophthalmology, and we looked at moving from being a generalist to really going into laser focused industries such as ophthalmology. And what we found was when we started to build that kind of content in that conference, we really got excitement from the strategics, from industry. We got excitement from the investors, and we got excitement from the physicians. Mm-hmm. And the physicians wanted to attend. And what we were being told was we had a little bit of a different format. As I mentioned earlier, it wasn't clinician driven; it was innovation driven.
Right.
So the doctors were coming and seeing things that were coming for the first time. They saw a platform that they could actually help contribute. And that led to the development of Visionary Ventures, which is a venture fund that we're a general partner in and was created in 2015.
Okay. And expand on the aesthetics inclusion.
So with the success of the ophthalmology, we said, okay, what's the next logical step? This has worked really well. We've now attracted industry leaders. And so what's the next step? And it was just logical to move to aesthetics. And certainly with an Allergan being grounded here and the support they provided, it was really a partnership and has been a partnership to get the aesthetics focus kicked off, which has really just been 3 years now. Mm-hmm. We'll have our third aesthetic event this coming January, meaning January of 2022, which will be live. And we did it for the first time in 20. 21 was virtual, and 20 just snuck in. It was January, just before
I was there.
just before COVID hit. I know, and it was amazing because that was the inaugural event, and that was the first year, and that was probably where ophthalmology was after 5 years.
Okay,
so
we took off.
We took off, and what it was we were able to apply the lessons learned in ophthalmology.
You weren't starting from scratch.
Exactly. Right? So the lessons learned, good, bad, we were able to turnkey and move right away. I mean, I often tease and say the early days of ophthalmology, we were in the back of a restaurant with 40 people, and then it grew to something bigger than that, and then finally it graduated into a world-class type of a resort event. Well, we were able to bypass all of that and just move right into the Balboa Bay Club for aesthetics.
Right. And that was in 20. Mm-hmm. And that's at the Balboa Bay Club or Balboa Bay Resort.
The Balboa Bay Resort, correct.
Yeah, resort. I grew up down there, and it was a Balboa Bay Club. My mother lives there, incidentally. So I look forward to going this January 2022, correct?
Correct.
What's the date, actually?
The 20th and 21st.
Okay, so it's a 2-day event.
It's 2 days. So we're moving from 1 day to 2 days. A day in kind of 3 quarters. So, it ends at 2:00 on the second day. And, we're hosting events around that. There'll be ad boards, there'll be private dinners. So, we always want to add a social element to this thing too.
Absolutely.
So
are you going to have a gala event the night between the first 2 days?
We will have a nice cocktail reception. So a fun cocktail reception, but talk about January, out on the lawn of the Balboa Bay Club, seeing all the yachts and everything, it's not a bad place to be in January.
Maybe we should have a harbor cruise or something on a Hornblower or one of those big yachts.
That's actually in the planning possibility stages at this point.
Well, great. I look forward to attending, and hopefully some of my colleagues will also that like emerging technologies and in the aesthetic space.
Yeah, I think we really want to drive more attendance and more availability. I mean, we were almost full house the first year, and now as we go to hybrid, there's really no reason for people not to participate in some fashion. We want to welcome as many people as the facility could attend. We love the vibe. I mean, I often look at events and don't really measure the content on the pure quality of the content, although that's really important, but that's almost a given. To me, it's the buzz. It's the discussions that are going on outside in the hallway, at cocktail reception, in between sessions, and it's the camaraderie of bringing everybody back together. So those are the things that we really try and drive through the in-person. But we want participation, and if somebody doesn't feel that they can make it to a wonderful Balboa Bay Resort in Newport Beach in January, they're welcome to attend and live stream it, or the content as we look at it now is always available on demand, anytime somebody wants. So we think we've got all bases covered on this.
I'm sure you have. The attendees determine the buzz, and as you mentioned, it's more than just the content, it's the buzz.
Yeah.
And it's seeing your colleagues and the interaction and the things that happen outside of the formal presentations. However, who are your keynote speakers? I know there's many panels and there's presentations, but typically you have one or two keynote speakers, right?
Yes, we do.
And who have you lined up? If you can share that.
Yeah, I can. Okay. So for next year in 2022, Carrie Strom, president of Allergan Aesthetics, will be one of the keynotes, and Bob Radigan has accepted a role to either lead a panel or do a keynote. We haven't figured out exactly what that'll be, and we've got one other spot that we're looking at right now. So, we feel that we've got good participation, from that perspective, and I think we're far enough ahead of it now that we're going to get some of the bigger institutional and strategic industry companies that maybe hadn't participated on a virtual event for the first time. So we're looking to welcome organizations like MERS, like Galderma, things of that nature.
How about Revance?
Revance, absolutely. As obviously, Mark's someone we'd like to attract also.
Yeah.
And I think there's a product on the horizon there that the timing could be pretty good for Revance.
Absolutely, no question about it. So you personally, Bill, are relatively new to this aesthetic space.
I am,
which is good because you're fresh. You're not tainted. You've only been in the aesthetics business for what, 5 years, 6 or 7 years, something like that? I mean, you have terrific experience in technology and finance and private equity and business.
Yeah, really, if you look at it, it's even shorter than that. It's 3.
It's 3 since the first one.
Yeah, okay. It's 3, and it's incredible. It's amazing.
Help, I'd be happy to help you along.
I think I need a mentor.
I've been at this for over 40 years, actually.
And it's interesting, the nuances industry to industry. And I mean we've certainly we see differences between just device and pharma in the same company, and you look at something like an Edwards Life Science. They're a device company in cardio. It's pretty straightforward. Mm-hmm. Then you go on the, I'd say the polar opposite would be a J&J that's in a multitude of industries. I mean, it could be cardio, pharma, obviously aesthetics, ophthalmology, and you've got the pharma and device component. So, a much more difficult or complex organization to navigate through.
Isn't that the truth? You take a startup originally like Zeltiq, and then it goes public and it's device, and Mark's running it, right? And then it gets taken out by Allergan, the first Allergan, and then activists, and then now AbbVie. So it's pharma.
Yeah.
And the rules change entirely. And I was working with Mark Wazeltik and then working with the various people at Allergan on the acquisition and thereafter. And the rules changed totally. Compliance and all the lawyers and the layers of lawyers. It's just amazing to me to learn the new rules of the road. Device versus pharma and startup versus corporation versus publicly traded. It's just layer upon layer of change.
So I learn all of this. At the end of the day, I've been, I guess you would look at me and say, hey, I've been more operations driven on the revenue side. I mean, if I go back, in my career, it was really sales. It started as sales. I've run big businesses, but it's been more on the operational end and all of that. So, when I look at all these, I get to a level of the complexity and the technicality of the industry, but keep it at the aspect to say, hey, we really want to drive innovation. We want to help these companies operationally invest. We want to treat investors the right way, but build the companies. And so it's really all about building innovation. And your point, what's amazing is to see these entrepreneurs go from nothing to a company that's now commercialized or very close to it, get acquired, and what they do with that, whether they stay with it, whether they spiral it and go do something else. But the interesting piece is we've seen companies do IPOs recently, and the change in the CEO from a compliance perspective and a regulation standpoint of all of a sudden being a public company CEO versus the founder and CEO of a private company.
It's unbelievable.
And some just don't like it.
Yes.
And it's a world of difference.
Mm-hmm. Yeah, I'm more of a startup guy.
Yeah.
Full confessions, but yeah. Hey, you've been through different industries. You're new to aesthetics, but there's so many parallels with the other industries. If you were looking at a crystal ball and just in aesthetics now, and I know this isn't your long suit, but I'm kind of curious, given your naivete in a sense of this in this industry, I'd love to hear what you think the future holds. Like when you sit there and you think, you've been around aesthetics for 3 to 5 years. What do you think the future holds for aesthetics in technology, in terms of emerging technology? So 3 to 5 years.
Well, I see it. I see the whole innovation aspect accelerating quickly. Whether it's
across all of medicine,
but really inside of aesthetics also.
Okay.
I think one of the things I see is the patient profile too. And to me, the naivety maybe was the fact that, hey, basically you went to a dermatologist because you thought you saw something. You wanted them to check you out or whatever. Yeah. And you got Botox when you were a certain age or filler or anything. That's obviously one brand, but any of those brands, any of those fillers, you got that. Now, and I know I'm not saying anything that people don't really understand.
But I want your perspective on this. This is fresh for me.
But this is really being pushed down way lower. So, when you start seeing people that are millennials in their mid-30s, utilizing these types of products, and then you go even beyond that. I mean, I'm talking to people now that are in their mid-20s that are routinely going to their dermatologist for some type of a treatment. So, in my mind, what this is it's expanding the entire market and taking it from maybe older generational that you were kind of reacting to something to being more preventative, and that's just what it feels like to me. And
so, industry likes to use the word prejuvenation as opposed to rejuvenation. So historically, growing up, people would start showing signs of aging, and they'd see their aesthetic provider, derm, facial plastics, so forth, have filler, modulators, lasers, and so forth, in the pursuit of juvenation, if you will, to look better, to look younger. And as you mentioned, with the millennials, they started to avail themselves to fillers and modulators much earlier. And now, even the pre-millennials now are coming in to my offices and other offices that all over the country with the pursuit of not looking old. So it's the pre-juvenation generation. I don't want to look like mom and dad ever.
Right.
I don't want to see my first wrinkle. It's not about treating a wrinkle. It's I don't want to have a wrinkle ever.
It's it's almost preventative, right? Mm-hmm. And I think that's intriguing. I think that's really interesting. In terms of how that's opened up the market. To a much greater extent. It's kind of funny because when I was growing up. And I was in my youth, I was very athletic, and I'd end up, unfortunately, at the orthopedics office every once in a while.
Sure.
And I'd always wonder why was there an old person there? Because I'd always figured you only go to the orthopedic when you break something athletically. And now I'm kind of understanding that there's reasons as you age you go to the orthopedic surgeon. But to me, it's really that preventative aspect. So. I think the market's opened itself up.
So you see growth in the aesthetics market.
I see growth, and I think AI and things like that are really going to help drive it. We're starting to do a lot of work in AI right now. We're not sure exactly what the outcome of that is going to be. We've got an initiative that we're announcing very shortly, referred to as Health SoCal AI, and it's actually pulling together LA, San Diego, and Orange County for a healthcare AI initiative. And it'll have two paths, Grant. And one of them will be just creating more companies that are using and creating AI, create more funding for them, opportunities for investors, and really at the same time building, replicating what we've done in ophthalmology and what's occurring in aesthetics is create Southern California as a global hub for AI innovation. And those are things that Octane's prepared to do, and we do well. The second path on that really, though, is to deal with health equities or health inequities, to deal with precision medicine and population health, and how do we utilize AI that actually gives somebody a health plan for life. So I could see that almost fitting into aesthetics to say that prejuvenation is, hey, this is what your plan should be, so you don't get wrinkles at the end. You could take it a step and say, from an oncology perspective, can AI help drive somebody and say these are the steps that you need to take to prevent these types of cancers over time? So, we look at the AI initiative and say it'll drive a healthier population. And while it's focused to company and company creation and capital and all of that, it's actually something that can impact all the residents of Southern California across the board. I know aspirationally some of the doctors that are helping us put this together, and they're AI-focused doctors at CHOC or UCI. They're looking at this and saying purely aspirational, we'd like to create and make Southern California be the healthiest region in the world. Now that's an aspiration that could take 20 years to get there.
Sure.
But I do think there's going to be a role for AI, in aesthetics, in giving people that kind of roadmap of care, personal care.
I would entirely agree.
Yeah.
Now, Bill, thank you for sharing all this about Octane. But now, for the viewers, how would they get a hold of you or Octane, or more importantly, register for the meeting in January? What can they do right now? They're watching and listening. Give them a roadmap.
So here's what to do. Go on our website, octaneoc.org, and you'll see our website. You could go to the impact report, which gives you really a rundown on what Octane's accomplishments have been in the past year. It's probably an 8-minute digital read, but inside of that, you look at the events and pull it down. Go to ATS, Aesthetics Technology Summit, or the same thing. You could just go to ats.com and access it that way.
Okay, that was A as in Apple, T as in Tom, and S as in Sam, ats.com, if you want to learn more about the upcoming meeting in January. And I want to thank you, Bill, for sharing your time with us, for coming up from Orange County. I appreciate it. We've learned a lot about you and about Octane, and look forward to working with you as we go forward and you stay in the beauty business, the aesthetics business.
Yeah, I'd love to. And Grant, thank you for everything you've done. Thank you for your support. And, we'll work together on ATS for 2022.
Fantastic.
Appreciate it.
I'd like to thank all of you once again for joining us here at the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And we have a new mover and shaker right here. Bill, thank you very much, and thank you for Octane and all you do for us. Look forward to hearing more from you in the future. Bye-bye, everybody. Stay safe, stay well. See you soon.